About 50 to 60% of people have died as a result of cardiopulmonary arrest. Most of these people will be alive if the public are aware of a couple of things to do during collapses. Now, joining us on the show is Dr. Femi Ogunremi. He is in the studio, in our Abuja studio. He will be joining us to talk about basic life support, or cardiopulmonary resuscitation, as it is called. Thank you, Dr. Ogunremi, for joining us. Good morning.
Good morning. Good morning. Thank you.
Now, recently, just to lay a background for a lot of persons to understand what we are talking about, there was a video that trended of a man that was dancing and suddenly he fell to the ground. And a lot of persons thought that it was part of his performance. And so they left him on the ground, and later on the report said they picked him up, and then later on we heard that he died. And then most recently was Christian Eriksen, who was playing at the Euro 2022, who also collapsed on the field, and we saw what happened there. And the question is, why this incessant collapses? First, before we get to understand how to, resuscitate persons, what are the things that lead to this collapse, first of all?
Yeah, so collapses happen. Quite a lot of things will cause, an individual to collapse. Usually, for you to be alert, like I'm talking to you now, and you're talking to me, it means that your brain is functioning, is getting enough oxygen, is getting all the nutrients it needs. So if for any reason there's a sudden, an abrupt stoppage in the function of the organs that actually, supply oxygen and nutrients to the brain, then in that case, there will be a collapse. And those organs are the heart and the lungs, So we're taking air, the air gets circulated through the body, the the heart pumps, blood around the system, carrying oxygen and nutrients. And as long as this system functions, then we're okay. So there are diseases that can actually lead to a kind of stoppage of these two organs. It could be things like maybe heart attack, it could be cardiovascular problem or other problems. And usually the last thing that happens in life when somebody is going to die is for cardiopulmonary arrests, which then leads to this collapse.
Okay, sir. So I'm usually confused between a cardiac arrest and fainting, because sometimes people just fall down and then you use water and they get up. So how do you know exactly? How do you know that this is a cardiac arrest and this is fainting? How do you differentiate?
Okay, so somebody can faint when there's a momentary, shortage of blood supply to the brain, or maybe there's a problem in the heart when the heart fails, because there are a lot of tension, like an electric tension that goes around the heart. So if there is a kind of an abbreviation in the functionality of this, organ, then an individual can have a momentary period where you feel like you're passing out, and then you come round, or you can pass out shortly and you come round. So, firstly, let me pass the message here. If somebody is experiencing, fainting attacks, they need to be seen. They need to see somebody, because there are investigations that need to be done to make sure they're not warning signs to something that is sinister. So, if somebody faints and they do not, take cognizance of it and they carry on, then what can happen is, in the end, they might then collapse completely, whereby, there's a long period when this function doesn't, happen again. So if you have a long length of cessation of the function of the heart, then the person will pass out. Right. And if it's long enough, it can lead to things like brain death and things like that.
I wanted to ask my own question. My own question is, are there any signs to this cardiac arrest or cardio you know,
pulmonary resuscitation.
Are there any signs that your body should be telling you? And then Obiajunu's question was, what's the difference between fainting? How do we know someone fainted or had the cardiopulmonary? How do you know the difference?
So a faint is a momentary thing. It's not something that is long-lasting. So you can just feel fainting because there's a shortage, like I said, shortage of blood to the brain. So somebody can feel fainting. And that can happen if there's a kind of abrupt stoppage of the heart that is supposed to pump blood, you know, continuously to supply oxygen to the brain. So somebody can feel momentarily like they're going to pass out, but they don't pass out. So you can faint that way and then you come round, okay? And then if somebody faints, I mean, both of them they link up, because somebody that's going to collapse, they'll faint, and then that fainting, it lasts long, and they're not coming around because the stoppage is not momentary. It's something that has happened, the heart is stopped pumping, and it stopped pumping. It's not coming back. So somebody will say it's a faint if it jumpstarts itself, and then you come round. But if it doesn't jumpstart itself, you will not come round. So you will then go into an arrest completely.
So even when we sprinkle water, the person doesn't come around, you know it's... No, we need to know.
Is it right to sprinkle water, sir? Because Nigerians, when somebody falls down, they will just pour water on the person's face.
Right.
It's a very pathetic situation that that happens in Nigeria, where somebody either faints or collapse, and the next thing that we start doing is we're pouring water on their faces, or we put in something to stimulate them. Because when you faint or when you collapse, then we need to make a proactive action to make sure that the heart that is actually stopped functioning needs to come back quickly. Right. And that's where the cardiopulmonary resuscitation thing comes in, the basic life support that we do.
And that is where my
then the other thing that we need
question. All right. Quickly, you can round up on your statement, then we'll ask the next question.
Yeah, so the thing that we need to be mindful of is when somebody collapses and we do not do the right thing on time, if the length is long enough, I mean, your brain will survive 4 to 5 minutes. And after that, somebody will go into brain death. And a lot of this thing will happen at home. It will happen where there are no doctors. So that's why it's important for us all to be skilled in knowing what we need to do when it happens, to be able to do the right thing and keep these people alive.
Now, speaking about the right thing, what to do, where do we begin? And talk to us about that, about how to go about it.
Okay, so a system has to be put in place very quickly, whereby you go through the process of basic life support. The basic life support is a skill that everybody needs to know. Everybody basically needs to know. And I always tell people, when I tell you about basic life support, I'm telling you to know not because of you, just because of me. So if I know how to do basic life support, I can only help the second person. The person to help me is the person that is next to me if it happens to me. And we're all human. Anything can happen at any time. So the important thing to do is for us to know, to see the environment wherever this happens, because somebody can faint or pass out because of something that is very dangerous. Maybe there's an electric shock, and then it's hit the heart, and then the person is passed out. And then you see the person pass out, you need to be sure that the environment is safe for you to go and help the person. You understand? So the first thing to know is the environment safe around this person that is collapsed? So if the environment is safe, then you approach them. When you approach them, you need to check whether they're sleeping, because somebody might be sleeping and you think they're collapsed. So you need to talk to them. Hello, ask them, are they okay? Okay? So you need to call them and ask whether they're okay. So if they answer you, that means maybe they're sleeping. But if they do not answer you, then you need to shake them and tap them. Just call them. Will they come round? By tapping them. So if they do not come round by tapping them, then you need to check whether they are breathing, because now they are unresponsive when they're not listening to you. They're not hearing you by voice. They're not feeling you by touching them. So they're unconscious already. Now you need to check whether they're breathing. So when you then, you need to do a procedure that will say you tilt the head, lift the chin, and then you look, listen, and feel for breathing. I can demonstrate that in a minute. Look, listen, and feel for breathing. And then if they're not breathing for 10 seconds, then you can establish that this person is in cardiopulmonary arrest, which was exactly what happened on the pitch on that day, during the incident that happened during the match. So once you realize that they're not breathing, and they're unresponsive, then at that stage, you can then confirm that this person is in a cardiopulmonary arrest. So what you then need to do is to jumpstart the heart and the lungs. So you then go into the cardiopulmonary resuscitation, whereby you need to go, of course, you need to call for help wherever we are with the timing, because in Nigeria, I know we have situations where we don't have effective ambulance system. So the ideal thing would probably be to call for help and ask somebody to call for ambulance to bring AED, which is the defibrillator, the external defibrillator that would encourage everybody to have, not everybody, but at least if we can have a system where multiple people have this around us, it goes a long way. Now, so once we've done that, you need to start the cardiopulmonary resuscitation, 30 compression to 2 rescue breaths. And then we carry on doing that until the AED arrives, or help arrives, or this person comes around. There's quite a lot, not a lot, but a few things that we need to know about this.
Okay, doctor, please, you didn't tell me about the signs. You know me, I'm 60. I just need to know the signs.
Is palpitation part of the signs?
When your heart is palpitating, when you have a palpitation and the heart is pounding, palpitation means your heart is pounding. That is not a sign of collapse. It might be a warning sign, but it's not a sign of collapse. You understand? So, it's not a sign of cardiopulmonary arrest. When the heart stops pumping completely is when you talk about the cardiopulmonary arrest. An arrest means something has stopped working. There's an arrest. It's not working. So if you're having palpitation, your heart is working. It could be working very fast. There might be a reason for that, and then which needs to be checked. If your heart is pounding a lot of the time, there will be a need for us to actually check this out to find out why that is the situation.
I would like to know, is there anything we can do to prevent it from happening altogether? Prevent this cardiac
right. So it boils down to what we normally talk about, that we need to know ourselves, we need to listen to our bodies. If things are happening in your body, you need to listen to it. Like if you're having palpitation, you don't have palpitation normally. That's not normal. So you need to find out why is that the situation. It could be a warning sign. If you're feeling fainty, it could be a warning sign. And one common thing is people don't check their blood pressure. We need to be checking our blood pressure, because not checking your blood pressure is a silent way of going down this route. You understand? Because a lot of people are going about with a very, very high blood pressure, and it's just a ticking bomb that will just cause a problem at some point. So if we identify it quickly, we can prevent that leading to sinister situation where you then have a cardiopulmonary arrest. There are other things, maybe chronic illnesses that obviously will make this an issue. But I don't want to panic people at the same time. But of importance is we just need to check ourselves. Do your check, like I always advocate to people. On your birthday, there's only one gift it's good for you to give yourself. Check. Go for your blood test, urine test, your heart tracing, or things like that during your blood pressure, during your birthday. It's usually a good thing to do.
Thank you, sir. So the case of Erickson that happened a few weeks back, as a sports person, is very fit. They do regular checkups. Are there other things that other signs that might not be visible to people, or can it just be random? Because his case was very, very strange.
Yeah. So what happens is, Cardiopulmonary arrest can happen at any time. It could happen even when you seemingly appear to be a fit person, and one way or the other, something just goes wrong in the or even the fact that you're fit doesn't mean that you're not having issues that you have not been paying attention to, because your body will always give you that warning sign. In his own case, unless one asks questions, you don't know. Maybe he's been having some momentary period of fainting that he didn't take notice of. You understand? And even when you are fit, there are some conditions that are associated with that could actually lead to the heart just stopping suddenly. And when we have young age group like his, collapsing like that, very, very fortunate when that happens, because if it were to be somewhere like in Nigeria, we know what the story would probably be. So if we have people, young age group, that have sudden death syndrome, they call it, there is need for us to check all the siblings and people who are, close family, to make sure. But unfortunately in Nigeria, we don't do postmortems. So we don't check people when they die suddenly, and we do not know what caused their death, to be able to see whether there's anything that we need to check the siblings for, or, and then so the siblings can then develop something similar, which is not going to give anybody, any warning sign. So our system, again, I will always come down to that. The system that will run, health system will run in our country is a bit skewed.
So how regularly, a final question, should we check our blood pressure?
Sorry?
How regularly should we check our blood pressure? Our final question to you.
Okay, so it'd be good to check our blood pressure at least. If you don't have a problem with your blood pressure is not high, I think, okay, once or twice a year is good to check it. But if you have issues with the blood pressure, maybe a bit more frequently.
Dr. Femi Ogunremi, thank you so much for your time on the program this morning.
Yep. Thank you.
All right.